Hi guys, my name is Shell, and I'm in a group with Alex and Professor Christofferson. We are arguing against the topic that talk therapy should only be allowed to be used if we don't know of any effective medications. We will be making the case that talk therapy should be allowed no matter what the circumstances are, and should still be allowed even if there are effective medications for the condition. I will be supporting our case using several research studies supporting the facts that talk therapy is shown to be beneficial when used in addition to medication, and that talk therapy has also been found to be just as effective as medication in many circumstances. There are many studies that show that talk therapy is shown to be effective when used in addition to medication. In cases involving bipolar disorder, PTSD, and depression, cognitive therapy has been found to increase positive results when it is used in combination with medicine. A study by D. Lamb and colleagues shows that cognitive therapy helps with the relapse of bipolar disorder, while another study by P. Resick and colleagues shows how effective talk therapy is when used in combination with exposure therapy. Another study shows CBT's effect on adolescents with OCD and specifically mentions that CBT should be regarded as the first-line equivalent to anti-OCD medication, with the potential to lead to better outcomes when combined with medication than medication alone can provide. Another study also comparing and contrasting the effects of medication alone, psychotherapy alone, both in combination, and psychotherapy with a placebo medication, was shown to be more effective when use of the combination of the medication and the psychotherapy was used. It was more effective in reducing depressive symptoms compared to the medication alone, but not to the psychotherapy alone or the placebo. There are effective medications out there, but this does not mean that talk therapy shouldn't be allowed. If there are effective medications, talk therapy can still be used and be useful when it is used in adjunct. Furthermore, even if there are effective medications for a condition, if a patient doesn't want to take the medication, is allergic to the medication, or has other health issues not allowing them to take the medication, then they should still be allowed to use talk therapy even if the medications are effective for the condition. A study by S. Demijohn and colleagues shows that behavioral activation, a type of talk therapy, is comparable to antidepressants for severe depression, even though antidepressants are considered to be the first-line treatment for severe depression. One more study by D. Antonicchio and colleagues shows the effectiveness of cognitive behavioral therapy versus taking medication, and the results show that cognitive behavioral therapy is just as effective as taking medication in the treatment of depression, even in severe cases. If psychotherapy is just as effective in treating depression as medication, if a patient doesn't want to take the medication, they should be able to use psychotherapy to help them with the depression. This also goes into play when it comes to a patient not wanting to take a medication because they're allergic to it or because they have health issues causing them not to be able to take it. This viewpoint can also be compared to the many different conditions because talk therapy has been shown to be effective therapy in many types of people suffering from many different problems. Altogether, it is very obvious that talk therapy should always be allowed, even if there are effective medications available. Talk therapy is shown to be beneficial when used in addition to medication, and talk therapy has also been found to be just as effective as medication for many people suffering from many different problems. Thank you.